Purna Suresh from Guidehouse. And most of you already know Guidehouse is working with the Department of Health on a range of rate studies, and one of them is the Long-Term Services and Supports Rate Study. To support the study, we are conducting a survey to collect information from providers on wages and costs. And today's meeting is a training session that is focused on the survey to review the goals of the survey, the several areas of reporting, and we will also cover some of why we are asking for the information and how the information may be used. And before I jump into the content, I will flag that this session is being recorded. And this is the first of two sessions we will be conducting. Again, the content of these sessions are identical. There's one today and then there's one next Monday on the 21st. In terms of what we will be covering, they are identical, but you can feel free to join one of them or both of them. And the sessions are being recorded and will be made available on the DOH website. So that will be distributed to all providers. Or just letting all our attendees know today that this meeting is being recorded. Right. So just jumping into the agenda for today, we will start off with just providing some background on what is covered in the survey. So essentially in terms of should you be on this call? The services that are covered in the surveys we're discussing today, do you provide those services? So we'll go over essentially the provider agencies that should be on this call based on the services that are in scope, and then how to access the survey. Then we'll spend a little bit of time on the broader goals, like how all of this essentially feeds into the broader rate study process. And then we'll spend most of our time walking through the survey, wrapping up with just the logistics in terms of how submission works, tips and tricks, and how you may receive technical assistance from Guidehouse over the course of responding to the survey. So let me jump into the next slide and just, to talk about should your organization complete the Alaska LTSS provider cost and weight survey. So we, in terms of the surveys that were distributed, so on Friday, essentially Friday last week, October 11th, everybody on this call your organization should have received the surveys. And these surveys are essentially for organizations that provide any type of long-term services and supports. And it's aimed at collecting information about provider costs. So that's the main goal of the study. But more specifically, which services are we talking about? So we're talking about services that are provided under these DOH or Division of Senior and Disability Services programs. Three of them specifically: Personal Care Services State Plan, Community First Choices State Plan, and then the 1915C Home and Community-Based Services. But more specifically, you'll see that these are the specific services that are included in the surveys. So under personal care and community first choice, we're talking about personal care chore services. And under the waivers, we're talking about a whole host of services that fall under the 5 1915C Home and Community-Based Services waivers. And so this includes essentially the waivers that are meant for adults with physical and developmental disabilities, the Alaskans Living Independently waiver, the IDD or the Intellectual and Developmental Disability waivers, as well as the waiver for children with complex medical conditions. And you'll see it includes a whole host of residential, non-residential services. And so I'll just ask that, you look at these list of services just to, very much acknowledge that, okay, you provide at least one of these services, and therefore the surveys that we've distributed are surveys that you would have to respond to. All right. So moving to the next slide. Now, on the flip side, we do say that if your organization exclusively provides only care coordination or targeted case management services, then whether it's under the waiver, under TEFRA or Community First Choice, then the surveys that we have distributed already are surveys that you do not have to respond to. There will be an exclusive LTSS care coordination survey that will be released at a later date. And then we will send a separate email as well to the care coordination organizations to ask you to respond to that survey. And one of the key reasons also is that there's going to be an exclusive focus group that will be conducted with a representative group of care coordination and case management providers. And this comes from feedback we've received already from providers. So the surveys we are discussing today do not capture care coordination or targeted case management. if you only provide those services. But I will acknowledge that we know that there are agencies that may provide care coordination in addition to some other, let's just say, home and community-based services or waiver services or personal care services. In that case, these surveys are still meant for you. You are requested to complete the general survey. And then when the care coordination survey goes out, you'll again be intimated to provide some more additional information that's specific to care coordination or case management. And then I'll wrap up by saying that the survey also does not capture any services that are billed at cost or not at a standardized rate. So these are more particularly services like, the environmental modification services and similar services that are typically reimbursed at cost, and they have some sort of a spending cap or an allowance or a maximum limit for these services. So those will be discussed as part of provider rate work group sessions, more focused sessions, but those services and questions on the services are not included in the survey. All right. So I'll pause here. I know I see in the chat that I did see a comment saying that my voice may be echoing a little bit. So I'm just going to pause to see if it's still occurring or if the audio is okay to everybody. So if anybody could just give me a thumbs up or a comment in the chat saying, it sounds okay now, then I will proceed.
You sound fine.
Thank you. Appreciate the thumbs ups and the comments in the chat. Perfect. All right. So that being said, so repeating myself again, that the survey today does not capture care coordination, targeted case management. So if you only provide those services, we ask that you can feel free to stay on, but you can also feel free to drop. So you can save your time for a future session that will happen and a future meeting that will happen, a training session that will happen specifically for those services. All right. So without further ado, let's jump into just how to access the survey. So everybody on this call, you or a representative from your organization should have received the survey via email from this Guidehouse email ID and with this very specific subject line. And we put this up on your screen. So, we sent this out Friday evening. So if you haven't seen it yet and you want to see if you received the email, you can actually search for an email from this email ID or by the subject line. And there's a screenshot here too that shows you that there should be 2 attachments with it's a pretty lengthy email that tells you in detail what's captured in the survey and in terms of expectations and timeline. But just say you haven't received the survey, an organization hasn't received the survey, you can drop us an email at this AK rate study, ltss@guidehouse.com email ID, and we will respond with the Excel workbook. So you will have access to the survey if you do not have access already. So we will include this email ID again towards the end of this call, but I would make note of this in case you haven't seen the survey already or you want to search for it based on this email ID. All right. But once you find the survey, moving to the next slide, we ask that you save these Microsoft Excel workbooks. And there's a default extension, but I specify this extension. It's a .xlsx file. And there are 2 files. So there's one that we call a general survey. So you'll see the word general in the file name. This is meant for a broader range of services. And it captures all the services, including meals. But we also have an exclusive meals only survey, which has the word meals in the workbook name. And this is because we know that there are some providers that only provide home delivered or congregate meals, and you don't provide any other services. So in that case, it will be sufficient that you only respond to the smaller meal survey. But if you provide meals in addition to many other services, we ask that you take the general survey. At the end of the day, the meals questions are captured in the general survey, but we created that separate survey. So if you're a meals only provider, you wouldn't have to worry about a whole host of questions that are captured in the other survey. All right. And then once you save it and open the workbook, you will be prompted to enable content. So we ask that you hit that enable content button. So then it'll enable you to start responding to the questions in the survey. And you can proceed with, responding to the questions and completing the survey in the process. All right. So this is just some initial information on how to open it, access it. Towards the end of this call, we'll talk about other resources you may have to assist you with responding to the survey. But I will just kind of hold some of those details towards the end. For now, we are hoping that, if you haven't seen the email yet, that you search for it and save this workbook down to your local system, or ensure the people in your agencies that should have access to it or have to respond to it on your behalf, that they have access to the workbook that you will need as an organization. All right. So I'm going to jump into providing an overview of the rate study. So this is just more broader context before we dive into the nitty-gritty of the survey. So jumping into the next slide, we already spoke about the services in scope, but I did want to highlight that the ones in green over here are essentially the services that are included in the surveys we're discussing today. But the rate study itself more broadly includes a few other services. So the range of care coordination, case management services, as I mentioned, but also any other services that are reimbursed at cost, like personal emergency response system, environmental modification, and similar services. And the last one I will call out is this rate study also includes analyzing or identifying what operational costs of a in-state intermediate care facility for individuals with intellectual disabilities could look like. And we know that an ICF does not exist within the state right now, and this is just essentially a study on the site to identify what the operational costs could be. And this was mostly just to share with you all. Again, the survey does not capture any questions along these specific to this, but we just wanted to show you the full range of services that are included in the study, although the survey may not have questions about all of these services. But for the sake of today's discussion, we will focus only on those services and those programs highlighted in the green font that you see on the slide. With that, let's jump into the next slide and just talk about the goals of the study. Right. So in terms of the goals of the study, more broadly speaking, of course, promoting access to healthcare for all Alaskans from a rate setting standpoint and supporting budget sustainability through advancing efficient and effective care. And then over the course of the study, we'll do two things. One is look at the existing services, rates, and the methodologies, but also looking into the future. What does the future of these services and rates look like, or what should they look like? And also alongside that, considering what accounting for how the reimbursement framework or adjustments may be based on the needs of individuals and the complex needs of individuals and the diverse geographies as well. How costs may vary depending on whether we're in the hubs or in the villages. And you'll see even today in the survey, we will discuss some of those details as to how we aim to get some of that information from you. And then engaging with community partners is a key piece of this. One of it is through these training sessions and through getting information from the surveys, but also we are having focused sessions with a provider rate work group, which includes a subset of providers on this call today, as well as looking into the future. We will have engagement with tribal health organizations and also listening sessions with individuals with lived experiences and their natural supports. And all this work will end with a comprehensive fiscal analysis and a set of recommendations that will go in a final report to DOH. And the goal is to wrap this up by July of 2025. Right. So in terms of this provider survey itself, we're talking about a 2-month time period. We'll talk about key dates towards the end, but I did want to give you a heads up that 2 months of this essentially rate study is focused on giving this group and giving you all on this call time to give write to us in turn through the survey with information and reporting back to us on like data and experiences you have on the ground through quantitative and qualitative information in the survey. So that is a big deliverable and a big piece of the broader rate study. Right. So before I jump into the next section where we jump into the survey, I am just calling this out that we are keeping an eye on the chat. So if you have any questions or comments, you can leave them in the chat. And then if you really want to, share a comment verbally or ask a question verbally, you can also use the raise hand feature on Teams. And our team is monitoring the chat as well as the raise hand. So, the goal is not for us to just speak to you, but also for us to hear from you, especially if you have any particular questions about what's asked in the survey. All right. So with that, let's jump to the next slide. Now, the rest of today's discussion is just going to be provider cost and weight survey. And I'll start with just what is the purpose of the survey. So going into the next slide, we broadly say, just to capture provider cost data, which is definitely the foundation for the rate review process. But also more specifically, the goal is to receive uniform inputs from across all providers to develop standardized rate model components. So you'll see that we ask very specific questions about different types of costs, and they're very specific data fields because the goal is to be able to get standardized information as much as possible from your agencies. But we also acknowledge that some of y'all may be independent providers, some of y'all are agency providers, and also you'll operate in different parts of the state. So the goal will also be, when we get this information from you, for us to be able to delineate where costs may vary and acknowledge them based on geographies, the types of clients you serve, and also, maybe recent changes that have been made in your organizations that are provided through the survey. And so while we ask for, information, when I say historical costs, either the most recent quarter or, most recent completed fiscal year, when we look into developing rates and looking into the future, we will also look into inflationary impacts and how the economy may impact what costs would look like, and hence the rates in the future when the rates may be implemented. So I did want to acknowledge that with this group, because when we go through a lot of the survey, you may have questions about, hey, like you're asking about our most recent fiscal year, but things have changed even in the past month, or may change in the next couple of months. So I will say that there are a couple of questions where more forward-looking questions where we ask about anticipated changes. But in instances where we do ask for historical data, there will be, we will look into making adjustments based on inflationary indices, whether it's based on growth rates we may get from you through the survey, or several public data sources we will be looking at to understand, what external impacts may also be on the future of costs for the LTSS system. And then outside of that, another key piece, which I think Alaska already does well, especially with the long-term services and supports, rate equity. So where required, whether the rates for similar services across populations should be identical, or similar services across multiple programs, should they be, the same? Now, the answer may not always be yes, but the goal as part of the study is to ask those questions as well. And then outside of all of this is also soliciting general feedback as part of service delivery improvements and efficiencies. So you'll see the survey will also ask several questions about how you deliver services and typical staffing patterns and how much time providers may typically spend on different types of activities that are integral to delivering services. So it goes beyond just the cost, and the wage piece is extremely important, yes, but the survey also goes beyond the wages and the costs to understand, how you deliver services on the ground and what staffing patterns and transportation, for instance, may look like for different types of services. Right. So with that, let's jump to the next slide, and I'm just talking about. So this is just fleshing it out a little bit further. While I gave you, some general background on the goals of the survey, now what does the survey actually capture in more detail? So there are 6 tabs in the survey. Running from, when you start the survey, you'll feel like it's more broader information, and then we dive a little bit deeper as you explore different sections in the survey. And so I'll quickly provide an overview, and then I see some comments coming in, so I will address them. So going into section number 1, so first we start with organizational information. You see we ask for general information about your agency, who's responding to the survey, your revenue, some general details around the number of sites you may operate. And then we get into tab number 2, which is total costs. In this tab, we ask for a lot of different types of cost information, whether it's like salaries, benefits, administrative costs, program support costs, different types of capital costs. And then tab essentially 3 is programs and services, where we ask you to identify the different types of services you offer. And then in turn, the wages associated with the different staff that are required to provide those services. And then also different staffing patterns. As I said already, we also ask for information around supervision time, direct care staff time, how many homes you may operate, how many miles may providers have to travel, whether it's on the ground or through air, to get from place to provide services. So that's the type of information we ask here. And then we do wrap up with benefits, the different types of benefits that your organizations may offer, whether it's for full-time staff or part-time staff. So that's the type of information we ask you related to direct care staff. And then we also have space for you to include any additional information if the other sections of the survey, if do not capture what you may want to convey. But all in all, what I want to emphasize on here is we'll go into each of these sections. So this is just an overview. We'll take one at a time and we'll go through them shortly. But what I really wanted to emphasize here was there are 2 sections, which is the wages section and the benefits section, which you see highlighted in green here, where we do ask for the most recent quarter's data. So for Q3 2024, which is July through September 2024. And the reason we ask for most recent data for these two sections is because we recognize like the wages form one of the biggest foundations of the rate, and understanding how those wages have changed, as recent as this past quarter will be important, because one thing the pandemic has taught us, and especially like changes in the economy coming after it, is month to month, some of these things change. And we also know that some of your agencies, with the start of the Save the New State fiscal year, you may have chosen to, increase wages or modify wages. And we want to ensure that we are able to capture the type of information that's latest and greatest in the most recent quarter through these sections. And same goes with benefits. We're looking at compensation as a whole, which is wages as well as benefits. And so we asked for the most recent quarters for those two sections. But for the other sections, we asked for your most recently completed fiscal year. So we asked for a whole year. But just keep in mind that for those sections, it's not that we're using historical data as is. Usually with those types of sections, for example, with your total costs, where you may report your administrative costs for the most recent completed fiscal year, we will look at, what those administrative costs may be as a percentage of wages. And because you're giving us the most recent wages, there will be an opportunity to see relationships between different metrics. And also we will be looking at, how to trend some of this information forward. So again, reiterating that some of these sections are for a complete, recently completed fiscal year that may be prior to July. But for wages and benefits and compensation as a whole, we do ask for the latest and greatest quarter, recognizing that there may have been changes or even anticipated changes that we would, like you all to report, and we would like to receive the type of information from you on these tabs. All right. I will pause here. I do see there are questions about, how the information that's captured in the surveys, whether that, will be used to lower the rate, for instance, or modify the rate. So all in all, what I wanted to, essentially mention over here is this survey is a starting point. So our goal is to be able to get any information from you to understand what the services look like. Not that historical costs alone inform what the future would look like, right? Which is why I speak about inflationary metrics and also like trending costs forward as applicable to see what services, cost of services may be in the future. So implementation is essentially the next step. I spoke about the goals of the rate study. One thing I did not explicitly call out that I'm saying now is that implementation is essentially, it comes after Guidehouse makes recommendations to DOH. So, of course, what happens with the rates ultimately would depend on like funding that may be allocated for these types of services. And that's the next step after Guidehouse makes recommendations in July 2025. So it's preemptive to speak to what may happen at the rates, but our goal is to essentially take a cost-based approach to understand what's the cost of providing services based on what you may report on the survey, and look at what the impacts are on those costs a couple of years down the line. So when DOH gets to a point of implementation, they have access to the information of where the costs are going as well. Yeah, so I know there's a specific question here saying you should ask for December paychecks that include bonuses. So I will say that, at the end of the day, just to get uniform inputs from all providers, when we say provider organizations, most recent fiscal year, we understand that your year may vary from organization to organization. Some of your agencies may end, may go from a July to June cycle. Some of you all may follow the calendar year, January to December. Some may follow the federal fiscal year from, say, October to September. So we essentially give you the flexibility in defining what that entire year is. So for instance, like in this specific case, if there have been any like changes, say, in the paychecks that you offer or bonuses that you provide, if you're able to give us a complete fiscal year's data for that type of information, or in the case of wages or benefits, if it's for the most recent quarter, you should be able to report on that. And we do ask for a very fixed time period because at the end of the day, we want to be able to get uniform data from all agencies. For instance, if we were to include a more forward-looking quarter, like say Q4, for instance, which is October to December, we may not end up, all agencies may not be able to give that type of information, and it's not, essentially a completed quarter But you'll see we have areas in the survey where we ask you, are there any anticipated changes in the wages, right? From say SFY 24 to 25. So you will have the opportunity to give us the type of information, but we are looking at completed quarters or completed fiscal years. So even with those fiscal years, if for instance, if there were bonuses that are offered in December, that would be captured in your total cost tab by means of you sharing with us the type of benefits or the types of costs that were incurred as part of like salaries or wages or benefits in a complete fiscal year. Right. So I hope that answered both questions. If there are any other questions, feel free to keep them coming. Like I said, we're going to go into each of these sections in depth. So it may be more beneficial too for us to go over some of those questions as we go section by section. So what we're going to do right now actually is I see no other questions in the chat box, and let me just check if any hands are raised before we jump in. I don't see any hands raised either. So we will start with the first section of the survey. And again, I encourage everybody on this call to put your questions in the chat, raise a hand, and we will be happy to go over your questions as we go through each section in the survey. Okay. All right, with that, Sean, let's switch to the survey workbook. So while Sean does that, we are pulling up the actual survey workbook because we think it'll be beneficial for us to go through the workbook as it will, as you'll be seeing it as well. So what you see right now on Sean's screen is the survey workbook, and we'll take section by section. And I'm going to start with just this overview tab. So this overview tab, as soon as you open the survey workbook, you'll see a lot of the instructions we already shared with you around like, who should respond to the survey or what does the survey not capture. That's basically in this box at the top. And I think it'll be mostly important if you have someone else in your agency that's responding to the survey. Of course, they'll have access to this recording, but we've also put it in writing. So anybody responding to the survey can see those types of details at the top of the workbook. All right, so if you scroll down, there's more information on when the survey is due. So I don't want to save this towards the end, but the survey is due December 13th. It was released on Friday, October 11th. So you have 2 months up to December 13th to respond to the questions and then return the workbook back to Guidehouse. All right. And there are a bunch of color codes. So I'll go through those codes when we go through the actual survey, but we've used a few color codes to indicate whether you should provide responses, whether some of these fields are auto-populated, whether some of these colors indicate examples. It is a comprehensive survey, so we've tried to use some of these color codes to make it as clear as possible as to what the provider agencies actually have to respond to versus what may be more informational or auto-populated within the survey. And the bottom of the sheet also includes how to navigate to different sections. So you can just kind of click away at these sections and they'll take you to the individual sections. But what we're going to do today is we leave you to see some of these details at your own pace. But what I'm going to do is when I go through the individual tabs, and my colleague Sean is also here, we will demonstrate to you some examples of what these color codes mean. And what these color codes mean and how to kind of navigate the survey based on some of these indicators. And all in all, I did want to say, and I see a comment in the chat, I did want to say that we're encouraging participation in this survey as much as possible, because the main goal of this survey ultimately is to receive data from you all, the providers, so we can use that information to inform the rate study and inform what the future of the LTSS rates could look like. So while, again, this is not an annual, cost reporting process or cost serving process that the state is conducting, this is like an independent process that Guidehouse is conducting and working with DOH. So I will say that we strongly encourage participation in the survey. And, our key goal is to receive the information from you. So at the end of the day, the analysis is only as good as the data, right? And we think some of the most meaningful data can come directly from providers. So I did want to say that, in terms of there's a question around what, the repercussions may be if a survey is not completed. At the end of the day, what I'll say is we strongly encourage participation and we would benefit from getting your data. And then another thing I'll also say is we will be going through each section today. And if you as an organization particularly feel like you may face challenges with responding to a specific section, we do ask that you bring some of that up. And we may also, have a one-on-one conversation with you outside of this meeting so that you have the opportunity to ask us more specific questions, because some questions you may have may not be specific to all agencies and all organizations. It may be more specific to your agency. So we're happy to take some of those questions as well one-on-one on this call, but also after this meeting through technical assistance. So we can, help you more in a more targeted fashion to get to what an end result may look like. All right. So with that, I'm going to proceed with the next tab. Just reiterating that any implementation decisions around what comes out of the study is the next stage. The first step, we're still in the first step, which is collecting information. Once we collect the information, we analyze it, and then any results that come out of the analysis may inform rates. Again, all this doesn't happen in a silo. We do have a focus group of providers with whom, which includes a representative sample from folks on the call today. We will be discussing the results with that group to essentially there'll be full transparency in the process and what comes out of the survey, what are the key trends we're seeing in the survey. Ultimately we'll then make recommendations that go to DOH. So I may sound like a broken record a little bit, but I wanted to emphasize that this is not the only process through which we're getting provider feedback. It is a multi-step process, this being one of the bigger ones through which we're able to get data. All right, so I'll jump to the first tab, organizational information. This tab, as I said, captures some more general information about who you are as an organization. So we do ask for information like, the name of your agency. We ask for your IDs as well, your provider IDs, your Medicaid provider ID. There is room for you to capture any other IDs. It was made aware to us from some providers that some agencies may have several IDs, right? So you can mark them in these additional identification fields as you respond to the survey, in addition to any primary ID you may have. But outside of that, you'll see some basic information about like your address, where you operate, where your HQ may be. And then if you scroll down, we also ask for contact information. So this is mostly information on who within your organization is going to respond to the survey. And this is more for us when we get your survey. If we have any follow-up questions, we would use the contact information over here to write back to you and get some additional information if we need any. So we do ask that any contact information provided here, we ask that it be someone from your agency we can contact, and like vice versa. Like you can contact us, we can contact you. So there's sort of that communication channel if required after the survey is submitted. Outside of that, we asked for a couple of questions here about how many sites you may operate, a number of unduplicated clients you may serve in the fiscal year. And we also ask for information, very broad information about your revenue. And in this section is where you really define what your fiscal year is. We ask for this beginning date and the end date so that any information that corresponds to the whole fiscal year would be the dates that you identify over here. And the reason we also ask for the dates is, when we get responses from vetting agencies that have different fiscal year cycles, it allows us to standardize or bring all that information to a more uniform time period to do apples to apples comparison. But in all, it's we're truly just asking for total revenue. Again, that's not like there's any sort of like comparison or in-depth analysis happening on the revenue here. It's mostly just to get a better understanding of the scale of your organization and what your primary sources of revenue are. So there are a couple of questions for you to just identify total revenues across these different categories in the survey. All right. So a couple of other quick things I'll mention here as we jump into this tab is like all the tabs in the survey have a pretty similar structure. So you'll see the top of the tab has this blue label that tells you like what's the title of the worksheet, right? This is organizational information. Similarly, this would change from tab to tab. Another key thing I will mention here is row number 5 here has the time period for the data requested. We went through this in the slides already, but this, because it does vary from tab to tab, we clearly state here whether this is, the most recent fiscal year or it's the most recent quarter. So we've clearly defined what that is in every tab. There's this green font at the top. So when you are responding to the survey or organization is doing so, we ask that you look at the time period at the top while responding to the questions. So you're fully plugged into, what is captured in the survey. I mean, what is asked, what's the time period asked for in the individual sections. I'll say a couple of quick things and then I'll go to the chat with the questions in the chat. Another thing is instructions of the survey. So when you hover over, so for example, if you go to the yellow boxes to the right, where you provide responses, if you hover over them, you'll see there's like a pop-up that appears, which basically gives you some instructions. So Sean, if you just hover over any of the yellow boxes to the right, it will be helpful to demonstrate to, yes, there we go. So if you hover over them, you'll see there's a pop-up that tells you what you need to enter. Again, this is the most simple tab where it may be more straightforward what's expected of you, but there are some other tabs where we'll cover shortly where we've given you some instructions on when we ask you, say, for administrative costs or administrative salaries, what do we mean by it? What does it typically include? So we've offered some examples as well in those sections. So so essentially you're able to provide responses, all right? And I will say, I know there's basically a comment saying this example of the cost survey doesn't allow data entry. All right, so I will say that while you can access all cells, that's a really good segue into what you can access. Only cells where you need to enter information can you enter any information. So for example, if you try to enter any information in those gray boxes, the survey is basically going to tell you cannot enter information. But if you go over a yellow box, like for example, over here, Sean is entering it in a copy we sent to you. You can enter, like the date over there. But if you hover over any cells where you should not be reporting information, you are going to get a pop-up error that tells you that you cannot enter information. But we still wanted to allow you the flexibility to like click anywhere you want in the survey. But hopefully the goal is to make this easier for you. So only cells you need to be entering information in, it'll allow you to enter information in. So that should make your job easier, in that if something says you should not be entering information, it basically means that you don't have to enter that information. Right? So there are some questions over here about, they want to make sure that if there are multiple offices, then we can list them and their info in one survey. Correct. So if you do have multiple offices, have multiple sites, we ask that you submit one survey for all the sites that you operate and for all the offices that you operate. If you function as sort of one agency, we ask that you submit only one survey. All right. And then the other question is, what if your fiscal year ends only in December 31st? So in that case, we do ask that you report 2023 data. So like, for example, if you have a January 1st to December 31st cycle, you would report January 1st, 2023 to December 31st, 2023. All right. But you'll see with the wages section is where we ask for the most recent quarter. So if you wonder, like those are historical, right? We've made changes in the past 6 months, in the past 3 months. The wage tab, at the end of the day, we still ask for the most recent quarter, irrespective of your completed fiscal year. So you'll still have the chance to tell us how the wages may have changed, and then whether there have been any anticipated growth trends and that type of information. So in some of these tabs, if we ask for a complete fiscal year, you can give us a complete fiscal year, but you still have the chance to give us how some of those key components like wages and benefits have changed in the most recent past. So that will allow us to then, look at how to further trend some of those costs you may have reported for a historical year. So yes, there are questions about consolidated financial statements and offering 12 different services. Yes, so you would submit one survey for all the services that you provide. Let's just say under the 9015C waiver, you offer a whole host of services like say day services, residential supported living, maybe some personal care services under the state plan too. So in all those cases, you would submit one survey that includes all the services. And sure, you can use your audited financial statements to inform the information that you may include here. But I'll also acknowledge that I know you all submit financial statements to DOH and to SDS. So this process goes above and beyond any reportings you regularly make to the state. This is an independent survey that Guidehouse is conducting as part of the long-term supports and services rate study. So we ask that you submit this survey as sort of an independent deliverable, but you could use any financial statements or information that you submit to the state to include information here. But at the end of the day, I will say that this is not like an audited process, which is why you see in certain sections we ask for the most recent quarter, because we do want to be able to get information that's latest and greatest. And that information may not have been audited, but it's essentially we're going based off of a good faith effort for you to give us latest and greatest information. And this information is not being audited, but if you're able to use financial statements, audited information to inform this process, we would encourage you to do it, especially because I know some agencies already follow that type of process. So in fact, it may be easier for you to follow that type of process. Okay. And there are questions about where to report grants. Yes, so can we, exactly. 18H is essentially where you would report that type of information, right, related to the grants. And I will say that really liking the questions coming in, because what we plan to do in 3 weeks from now is we will be releasing an FA, a frequently asked questions document that will capture all the questions we're getting today, as well as a survey training session we have next week, or any questions we get in our mailbox, in our email box. So I will say, any questions we're addressing now, yes, it's in a recording, but we will also put it in a frequently asked questions document that will be distributed for your access beyond this training. All right. So similarly, we can clarify where those types of grants go into 18H. All right. One quick thing I will demonstrate here is there are some validations also included in the survey. So for example, if you go to say the phone number that we've asked, if you do not enter, say, a 10-digit number that's asked under the phone number, the survey will tell you that, it's incorrect. It won't let you enter it. Yeah, there we go. So it will say, please enter 10 numeric characters. So this is not always the case, but with key fields where, we do want some specific length of information or type of information, those types of validations have been introduced. We're hoping that will make it easier for you as to what's expected, but B, it also allows us to get standardized inputs from all the providers when we eventually have to analyze it. Right. This is, again, a simple example. I think phone number, email ID is understood, but because we have it in front of us, I just wanted to demonstrate that. You'll see that kind of carry forward with a few other things in the survey. All right. I see no other questions, so let us move to the next tab and talk about total costs. All right. So this total cost tab is essentially, this is definitely one of those tabs that, relative to other parts of the survey, we do ask for quite a bit of information, because it is also one of those key tabs. I think 2 and 3, costs and wages, are essentially areas where we ask a lot of the quantitative information. So you'll see that this section has 5 subsections that focus on salaries and wages. And Sean, if you scroll down, benefits. Yeah. And Sean, you can do one thing. There's an arrow at the top of the workbook that you can minimize on the right-hand side. Yeah, you can. There we go. Perfect. That creates more room for us. So there are 5 sections that focus on salaries and wages, taxes and benefits. And then if you scroll further down, number 3 and 4 focus on administrative costs and program support costs. And we end this section with section number 5 on facility, vehicle, equipment. So a lot of the different types of capital expenses are captured at the bottom. So the goal here is to be able to get information, essentially line by line information from you on different types of expenses specific to the services that are in scope for the rate study. So you'll see the columns here from D through J. They ask you to allocate the different types of costs across the different programs. So column D will be a little more straightforward, which is just total general ledger expenses. There should just be your total costs across all the programs and services. But then column F through J is when you go into the allocations. We do ask that you split costs based on the state plan program. So the personal care state plan, the community first choice state plan, that goes in column F. Column G are all the 9015C waiver program expenses. Column H is again TEFRA. Again, TEFRA care coordination is not specifically in scope for this survey, but we know some of your agencies provide care coordination in addition to other services, which is why we wanted to clearly demarcate TEFRA in a separate column. And then we have room and board. Of course, per CMS, these are unallowable costs. So the term essentially room, when we say room, these are shelter type expenses that include property related costs or purchase of real estate and furnishings. So to identify those types of costs under room and board. And again, board would be, 3 meals a day or any full nutritional regimen. So these may be obvious to you, but we have included instructions when you hover over these cells or over these headers. So you can actually understand what's expected of each of these fields. All right. And before we get into the nitty gritty of it, I did want to acknowledge one thing, right? So some of your agencies may capture these demarcated costs across the state plans, the waivers, all the other programs. But there's also a chance that you may not explicitly capture it. So in that case, we still ask that you split them across the columns, but you use an allocation strategy to do that. So there are many different ways in which you can go about it. Again, this is not an exhaustive list of examples I'm giving you, but some of the more common ones we have seen and we would, say that can be used are, first is if you know what the revenue split looks like across these programs, you can use that essentially as a proxy to allocate costs across the programs. Similarly, if you know what the personnel costs are, or, across some of these programs, say waivers versus state plans, you can use that as sort of an allocation strategy or allocation percentage to split the costs between, say, the state plan and the waivers, right? So we ask that you use an allocation strategy to make allocations. And I recognize that some of these strategies may also vary from agency to agency. So we've included some of that in the instructions section at the top over here as to how you can go about it. But when you are responding to your survey, if you feel like, the instructions or suggestions offered may not apply to your agency or may be more challenging for your agency, then we ask that you get in touch with us so we can have a one-on-one conversation about what may work best for your agency. All right. And then another big thing I'll also say is, we've heard from some providers already about this, which is you may have, as an agency or organization, you may provide several other services and operate several other programs, but what we're asking for within these allocations are only the programs and services in scope. So if you have any other expenses that you may incur for other programs, we ask that you include that in column J. So at the end of the day, essentially, if you take a general ledger and remove all those other expenses, that's when you get the expenses that are pertinent to the services and the programs in scope. All right. So I see a couple of questions. I'm going to take them before we dive deeper. So what does the state plan refer to? And then there's also questions about how to allocate other like 1115 waiver service, 1115 waiver service costs. So for the purposes of this survey, when we say state plan, we're talking about the personal care services and the community first choice state plans. So that's what will go into the state plan program. And then the waivers would be, of course, the 9015C waiver services. For 1115s, especially because they're not in scope for this particular rate study, we ask that you put all those expenses under the other column, column J. Now, if you would like to explicitly identify that, what goes under the other column and 1115s are a major, you have major expenses in that area, there are specify boxes in column C. You'll see the word specify, where you can leave us some additional notes. Or even towards the end of the survey, we do have an additional feedback area where you can convey to us what may be a major expense for you. But for the purposes of this rate study, just because the 1115 services and those demonstrations are not services that we're setting rates for, those will go into the other program column. Right. And with regard to the state plans, another quick thing I'll say in terms of line by line instructions. So Sean, can you quickly hover over just, some descriptions in column B? So for each of these line items, you may have, specific questions about what is to be, captured in some of these areas. Yeah, so there we go. So where applicable, where we think instructions are necessary, we have included, what that line should include. So for example, in this case is training and development. So we say entirely training and development costs as it relates to, provision of direct care services. So similarly, if you hover over column B, you'll see very specific instructions about what's asked in that line. Again, in some of these cases, we provide examples of what the types of costs may be. It may not be exhaustive. But we have provided examples that we think are most relevant to long-term supports and services, so you are able to capture that. All right. And I know there are some questions about mental health services such as therapies and those types of services. So at the end of the day, I'll say anything related to behavioral health, mental health. I will say those are not particularly they do not fall under the programs that we had highlighted at the top of this meeting. Unless they fall under 1915C, say DD waivers, if it's any type of therapy intervention type services, those do fall under column G, right? And there's actually a separate tab, which we'll come to shortly, tab number 4. I ask that you keep an eye out for tab number 4. We've actually listed the different types of services that are included in this survey. So you can actually like kind of check them off and you'll know exactly like what is considered as, services that fall in scope versus services that come from other programs. Because I recognize that some of your agencies may be bigger and operate across multiple divisions within DOH. Potentially, and this is just me speculating, but you may be providing services that fall under behavioral health or certain types of services that don't necessarily fall under the long-term supports and services waivers or state plans. In those cases, you capture them under the other programs, all right? But if you're talking about any type of like intervention, therapeutic services that fall under the waivers, for instance, those have been captured in this survey. And when we go through tab number 4, we can, you'll have more insight into the different services because we've laid them out clearly by program. All right. Outside of that, the couple of quick things. All right. So these are Medicaid providers that have been asked to, like Medicaid provider agencies that have been asked to fill this survey more specifically, just to clarify the question about like who's being asked to fill the survey. And when we get to that programs and services tab 2, you will see like which services more specifically under each of these programs are being requested for in this survey. Right. And we will distribute the deck. The deck also very clearly states on the top of the survey, clearly states the programs that are in scope, the services that are in scope, and also the services that are not captured in this survey that you may broadly consider long-term services and supports, but they're not included in this particular survey. All right. But apart from that, couple of quick things before we jump to the next tab. I did want to call out that each of these lines, you'll see they're pretty detailed. We ask for things like what are your different types of, administrative salaries, program support salaries. So if you go to the top of this tab, I think that's a really good example that ties into some of the questions we're getting as well. You'll see in the first section number 1, we ask you to report total direct care salaries, supervision salaries. And then if you hover over them as well, we have instructions on what we mean by each of them. So if you go to maintenance, for instance, we ask for total maintenance employee salaries, which could be, staff responsible for housekeeping, janitorial work, repair work. Similarly, with administrative and program support costs, we go into, say, administrative could be staff that are, maybe involved in human resources or finance, or your C-suite, for instance, could be admin staff. And then program support or any other costs that are integral to service delivery. So Sean, if you move 2 lines down to program support employee salaries, you'll see it says here that these are costs that are neither direct care nor administrative, but they're maybe, workers that are integral to providing services like food preparation staff, for instance, or training staff, right? And then we have placeholders for contracted staff as well. But let's just say in your agency, there are staff that wear multiple hats, especially smaller agencies. It is pretty common that someone may be in an administrative role and in a direct care role. In that case, we ask that you allocate those types of costs between the 2 categories, depending upon the amount of time they spend in those roles. And we've also captured that under the instructions number 4 at the top of the survey. You see this very clearly demarcated as essentially as how you can allocate some of those costs if an individual or a group of individuals may perform in multiple roles within your agency, right? So a couple of quick questions before we jump to the next tab. I know that there's basically a question here on direct care supervision salaries and wages that your frontline supervisor do direct care as well as some other positions. So I think that's pretty much what I said. So you can allocate between the 2 categories depending on the time they spend in those 2 roles. And I will give you a heads up here. There's another tab where we focus on wages, where we do have captured where you can report anything related to turnover or unfilled positions. I know that's not directly related to expenses, but that was feedback we got from some providers that we wanted to ensure you have the chance to also share that type of information around any shortages or unfilled positions that you may have. And I know there's a question over here about like there is a similar survey on the mental health or behavioral health side. And if there's, essentially scope to combine them. So a couple of quick things I'll say here is firstly, because the cost information we capture here needs to be more specific to helping set rates for just long-term supports and services, One thing I'll say is combining it with the behavioral health or on the mental health survey will not give us sort of clarity on demarcating it. But I also recognize that there are some commonalities between the two surveys. So one thing I will say is if you are an agency that provides that's also submitting the behavioral health survey, and you may have reported some information in the behavioral health survey already, please drop us an email one-on-one. So where we can build some of those efficiencies. And if you have already, say, reported some of those wages in another survey, and they are going to be the same in this survey, please write to an email. So, where you may not have to report the same thing once again, we would ask that you wouldn't have to do that. But we do ask you to notify us. So, if we have to borrow information from our BH team, we just want to make note of your agency and ensure that we have everything we need from your agency. But I acknowledge that, you may be filling out two surveys. So where we can build some of those efficiencies and duplication, we can reduce some of that stuff by knowing what you've provided in another survey already. All right. And the compensation, and that's a great question. Yes. Under line number 12 is, between line number 11 and 12 is where you can capture things like, workers' compensation and any other types of insurance. So under line number 11, you could report, for example, like life insurance or long-term or short-term disability insurance if your agency offers. And then under other benefits, so if you hover over it, it actually has workers' compensation as an example. Any sort of retirement benefits, workers' compensation, those types of 401k plans, you can capture those types of expenses in line number 12. Yes. Okay. I think we've addressed all the questions. With this, let's move to the wages tab. So this is, again, another important one. We will spend time going over each of these fields. I'll start off with saying this tab is intended to capture only direct care staff and supervision wages. So I know we've had some questions about, does this capture, administrative salaries? No, this captures only direct care staff and supervision wages. But I will say that the total cost tab does allow you to report any sort of administrative program support expenses and salaries more particularly. So we will have access to the information in the other tab, but this one is just meant for you to report the wages associated with the different job types or the different staff that are employed to provide direct care services in your agency. Okay. So there's a question about, since we're submitting the survey, are we still going to submit the cost survey for the targeted providers as of August 1st, or is it the survey? All right, so I think you may be referring to responding to both the BH survey and the LTSS survey. So I think this is something we should discuss offline because I know there may be some agencies and want to get a better sense of magnitude, but we can take this on a case-by-case basis. But any questions asked, if you've already included information on an other survey that has been submitted, that is exactly what we're asking for over here, then we can talk about it in depth. But the question is talking about as of August 1st. So can you clarify further if you're talking about the cost survey that you submit to the state on an annual basis? Is that basically your question, or is this referring to the mental health or the behavioral health survey that you may be submitting as part of the rate study? To me, this is sounding like cost surveys that you submit to the state on an annual basis. Yeah, okay, I see that's been clarified, yes. So this is in addition to what you're submitting to the state already. So if you're submitting this to the state as part of the annual process, we ask that you repurpose that to give some of that information through the survey. And also, I will say that I know there are only a handful of providers that do that annual process. So if you do have particular questions about how you may repurpose some of that to respond to this, you can feel free to get in touch with us one-on-one so we can chat about it in depth. But this needs to be submitted in addition to any annual cost reporting process, cost surveying process. We commonly call it cost reporting, but I know in Alaska, you'll call it cost surveying. So if you annually submit anything to the state, this is above and beyond that. And all right, I see there's a comment about there's more than a handful, so we can discuss how you could repurpose some of that information to report here. But you'll notice as you go through the survey that a lot of the questions here are a double click on what you see in your annual survey. Your annual survey may not capture like in-depth questions about service delivery and service specifications. But if you feel like you've reported things like, hourly wages or certain types of costs, please write to us, and then we can talk about how, some of that, how you could repurpose some of that information in responding to the survey. But I do acknowledge that you'll have an existing annual process, and it may be beneficial for us to have a side conversation on how you could repurpose some of that information. But there are several areas in the survey that are not captured in the cost surveys that you submit on an annual basis. We did work with DOH to see what that template looks like and what it captures, and informed by that process is the survey and the questions that are captured here. Right. And Linnea, I will say that we do have access to those surveys, yes. And if there's the stuff that you've reported there already that is a duplicate, is in duplication of the survey, please get in touch with us and we can figure out how to repurpose those surveys so you don't have to report it again. All right. But we'll send out more information on, providers that have already submitted annual surveys. If the data you've reported coincides with this survey 100%, then yes, there are 32 providers. Then we can talk about how to repurpose some of that information. We do have access to those cost reports. We have seen the ones that have been submitted. And based on that, we have chosen to include some very in-depth questions in this survey. So I want to acknowledge, I know there are several providers commenting this in the chat. What we'll do is we'll essentially send a more targeted email after the training to talk about, and also we'd like to hear from you actually more specifically as to how the information you're submitting as part of that annual process coincides with it. Again, I want to reiterate that we don't want to make you do any sort of double work in terms of duplicate work in terms of what you're reporting here and what you're reporting there. It is something we can get access to, and it is something we can figure out offline, one-on-one, keeping in mind that there are 32 providers, yes, that are on that list of providers. All right, so I know we have about 30 minutes to go, so I do want to spend a little bit of time covering this, but again, I'm just reiterating myself that for those that submit annual cost surveys, we can talk about what's already been reported in those documents, and if it coincides with this, if we can repurpose that, all right? But there are certain areas I know that are not captured in those surveys that we would still request that you submit this survey for, all right? And we can cover some of that today. So quickly covering wages, this tab asks you to report different job types. So column B over here asks you to select. So we have a predetermined list of jobs. For example, you see we have an example here of a direct support service professional that may be more common for DD services. But we also have the ability, like say a chore provider for chore services. But we also have the ability for you to select other providers if as an other option if you employ different staff types. And then scrolling to the right, I'll say we've asked for you to also split this based on different geographic locations. So we've given a list of boroughs and census areas, especially with Alaska. There may be a significant difference based on the hubs versus the villages, and even different like boroughs and census areas. So you can select the specific area if there's a difference in wages within your agency based on geographies. However, if there is no difference, then there's also just an all option where you can select all and just report the wage in one line, all right? So scrolling to the right, these are just where you can identify the different types of services you provide. You just mark X's over here. But I want to move to the furthest right, just in the interest of time, to go over some of the key pieces. So we ask for you to identify whether they are employees or contractors or direct care staff or supervisors. Also, we ask that you report the full-time equivalents. So say your organization employs like 9.5 FTEs as it relates to direct service professionals. We ask that you report them just on one line as 9.5. And then in columns A, B through AC, where we ask for wages, you can report the average, the lowest and the highest for those DSPs, all right? So as much as possible, we ask that you report the averages in one line. But if you see geographic differences or key reasons to split them into separate lines, then you can do that. But especially if they are DSPs in the same region, the same role, and even across services, you can report them on one line and give us the average. All right. So if you scroll to the furthest right, so you see Sean's basically demonstrating to you that you can select specific regions or you can select all regions. If you go to the furthest end of this tab, beyond wages, so I will emphasize that the wages definitely one of the biggest pieces of the survey. And we ask you how wages have also changed in the recent past, right, over the last 3 years, but also any anticipated changes. So you can provide that in this tab. Apart from that, we also ask beyond the baseline wages. If your organization pays for any type of supplemental pay like overtime, shift differentials, non-production bonuses, we ask that you report like essentially the total number of hours and the total dollars that are paid, because we recognize that when we say wages, it's not just the baseline wages, right? Sometimes agencies may offer some sort of like overtime pay or shift differential pay that would have to be accounted for as part of rate setting. So in you reporting it over here, we're able to access that information. And just wrapping up with the bonus towards the end. And if you scroll to the furthest right, we ask for information. These are the only columns where we ask for annualized information, like number of training hours for new staff or staff that have been there for more than a year, any unfilled positions, what the turnover rate may look like. And this is actually feedback we got from some providers based on which we were able to make some additions to the survey. All right. So before jumping to the next step, I want to take the questions we have in the chat. So there's a question about what capacity do the agencies have to do the survey on. So I would ask if you could provide a little more clarity on that. One thing I will say, acknowledging a lot of the comments about the 32 agencies that submit cost surveys, we will take essentially our surveys on a more case-by-case basis, so you wouldn't have to report information again. But I will ask that you clarify a little more what the question was from James. If you provide some more clarity, I'm happy to address it. But if it relates to submitting the survey in addition to an annual cost survey, we can kind of take that on a more case-by-case basis with the 32 agencies outside of this meeting. Okay. And I will say at the end of the day, this is probably what I'm spending a little bit of time on this one because it's one of the most important tabs where the wage does form the foundation, one of the biggest foundations, the rate, especially with compensation as a whole. So, usually when we've noticed when providers find challenges reporting other areas too, this is one we definitely say, spend your time and energy on this one to give us the latest and greatest wages. And as I said, the analysis is only as good as the data, and we emphasize on getting latest data from you all beyond any other information we may use from publicly available sources or information we may get from the state directly. Right. All right, so just keeping an eye on the clock. Welcome any other questions or comments, but I am going to pass it to Sean, who will now dive a little bit deeper into like service specific areas. And this tab over here will also address a lot of the questions you may have about, which services are considered and how can you check off what you provide. All right. There's a question here about whether this process has been done in other states. I did want to add that, yes, like Guidehouse has worked with roughly 17 other states, and we've done long-term services and support studies similar to this one and surveys similar to this one in at least like approximately 10 other states. So we've gone through this process working with LTSS providers to get responses in these surveys. And I'll acknowledge that, yes, like some of these areas maybe more challenging than the others, but ultimately the goal is to be able to collect information directly from providers. But I just wanted to mention on this call that we are working with the state to get access to any information that DOH or the state may have access to, whether it's annual cost surveys or claims data or any information that would be meaningful to the rate study in addition to the provider cost and wage survey. While I place an emphasis on the survey and the importance of getting firsthand data from you, I will say that we are using other sources the state will give to us, as well as several other public data sources that are well known, used in the LTSS field that we've also used in several other states for benchmarking, for comparison. But that's another thing I'll add to what's said in the comment in terms of working with other states to do these types of studies. Yes, we've done pretty similar surveys, similar studies, similar services as well, and we also recognize that some of the questions you may have, we may need to discuss a little more in depth one-on-one, and which is why we also have technical assistance that we will provide over the course of the response period. Okay, and I see there's some comments about only providing like services to just a couple of individuals, and yeah, in those cases, James, if those are very small agencies, we'll want to chat with those agencies. And we're also explicitly saying here that there are some areas in this survey where if there are very, very small agencies, we may work with them on a more one-on-one basis to see what they can report to us. So if those agencies exist, please get in touch with us so we can talk about what you can or cannot report or how you can report some of that information. All right. Sean, I'm going to kick it over to you so we can cover the remaining three sections.
Thanks, Purna. And I'll just start off by re-emphasizing what Purna has said about completing the survey and how important it is for our data, that we can reach out to the state, we can get the information that you provided to them, we can go to public data sources, but when it comes down to it, this direct information from you is really, really valuable in helping determine what those rates should be, what any recommendations should be, because it's the most direct information we can get. Um, and along with that, I guess I'll go ahead and start on this Programs and Services tab. This is a great way for us to understand really what your organization is providing, as far as not only the specific services you provide, but also what waivers you provided under, as that may impact aspects of your service profile. This tab also controls all the blue tabs that follow that are labeled with for and a letter, as to how you're going to fill things out. And so as you're filling out this tab, as Porna mentioned earlier, this has all the services you might provide split between the waiver program and the state plan service. And you'll notice TEFRA up here in care coordination. And as you fill out this tab, it's simple as clicking on one of these in a not protected spot. And you just click from no to yes for any service that you provide. And I'm starting with care coordination just to note, we do want to know if you're providing care coordination under 1915C or TEFRA or case management under community first choice, but that survey is going to be coming out later in Q4 here. And if you provide both care coordination and lots of other services, when you go to fill out the care coordination survey, there will be a lot less for you to fill out because these other tabs you'll have already done. So we'll make that as quick and easy as we can for you. But for the rest of these, and I'm going to jump to the day services tab just for a moment. As you look at the day services tab and all the questions we might answer, you might be asked, there's everything's grayed out right now. But if we select that you do in fact provide adult day services under the APDD waiver, you'll see this pops up, says please complete worksheet 4A day services. And now that you've clicked that in 4A day services, all the columns that you would need to fill out are available for you to fill out. But just go through this tab, click yes on the things you provide. You can leave the ones that you don't provide alone, and then you can proceed to the other tabs where the real meat of the information is. And to look at that, we're going to take a look at the respite tab and fill that out together really quickly. So we're just going to do the agency-based part of the respite tab. And for ease, go ahead and fill this in a little bit automatically. But you'll notice as you're filling it in, you can only fill things in the spots where you're supposed to. If I try and fill in a spot where it doesn't accept data, you're going to get a pop-up that says, please don't enter data in here. And just go ahead and enter all of your information in. Now, at the very top of the sheet, you'll see that there's an incomplete box here because we have not completed this tab. So do fill in all the spots. You'll notice that I put a 1 here, but if you have anything to list, put it here. If you don't have anything to list for the average life in years for equipment purchased, you can just complete it with a 0. And when the tab is complete, you'll see a completion indicator at the top. And when we come back to programs and services, this is a good way for you to check all of your tabs very quickly and at once, because you'll notice this says complete. And there's a few different kind of types of tabs here. I'm going to jump back to respite. At the top of respite, we're asking about things like productivity. How do you spend your time? And you'll see this same kind of breakdown for a number of different services, because there are times where your employees are working directly with somebody, but they have other jobs to do that you pay them for, and it's not just the amount of time they're working directly with a client. So we want to know about that. We want to know your staffing patterns. How many people are you seeing at a time? What's the supervision ratio associated with that? and also about your transportation. And one of the fun things about Alaska is that you not only have ground transportation, but you do a fair amount of air travel as well. So we've asked about those separately and about your, your general costs, and then about your equipment and supply costs in a tab like this. Um, there are some, and I'll take just a second because I see things coming through.
Yeah, Sean, I'll cover a couple questions, nothing
Yep.
relevant to this tab, but it still doesn't hurt to like address some of these quickly. So there are some general questions about, with the much smaller agencies, are we still requiring them to submit the survey? I think the goal at the end of the day is we also want representation from agencies of different sizes. While yes, like the initial approach is okay, like we want agencies that, so many clients. And yes, like that is a key piece, yes, in terms of representation of the system as a whole. But also the goal to rolling this out to smaller agencies is to get representation also from how the smaller agencies operate, which is still integral to the system as a whole, right? So yes, we are requiring essentially sending this out to organizations of all sizes. But again, if certain agencies face specific challenges, we ask that you reach out to us or put those questions in here so we can speak with you. In terms of the survey results and how the information shared will be interpreted. So this is a 2 month response period. Once we receive the responses, then we will spend a few more months kind of analyzing the survey. As we mentioned at the top of the call, and you may have seen in the initial outreach email to you from the state, we are working with a subset of providers that's called a provider rate work group, with whom we will be discussing like aggregated results that come out of the survey. So the step-by-step process, we get the results, we aggregate it early next year, we have conversations with a subset of providers. And ultimately the goal is to package all of this in the form of like rates and recommendations to the division by July 2025. All right. There's one question about out-of-state agencies that have a client in Alaska. Yeah, we asked that it's not necessary for you to submit this survey, especially given this one client specifically, and you operate from outside the state. If you do not operate within the state and the only client you have is that one client in one Alaska client in an Alaska program, yeah, you can feel free to skip this survey. Right. But Sean, no other questions specifically about this tab. If you want to provide some more context, feel free to provide it. Yeah. And just doing a quick time check, we do have 10 minutes to go.
Yeah, and I will emphasize again with smaller providers, if the only people who the only organizations who complete the survey are large providers, then that's the only information we have. And small providers face different challenges than large providers, and we really need to know about that to create recommendations that serve everybody. So please, if small or large provider, if you're able to complete this survey, do so. And if you have any trouble, we are absolutely here to help you. We'd be glad to create a one-on-one call or answer any of your questions via email. I'm going to jump to residential supported living. I did see some, this would also be true for group home, and we'll jump over there as well. We do ask questions about different sizes of living situations with 5 or fewer beds, 6 to 16 beds, 17 plus beds. Similar with group homes. I saw a question early in the chat about do we need to report on each group home? We've asked you to report on those group homes based on their size, rather than each one individually. But we do want information based on the size of your group home and what you normally operate, so that we have an idea of how that scale impacts your particular operation. And we have asked questions, about the size, number of homes you're operating, total number of beds, as well as how much you have vacant unique clients in a year. But then about your staffing, how do you staff on a particular day, and throughout the week for your different sizes of group homes? How many staff does it take you to operate that group home? Similar questions as what you saw in respite with supervisor span of control and travel, different transportation costs, and in this case, vehicle details for the different homes that you have, because there's a need for transporting people. Moving on to another good example, family home habilitation. In this case, the number of questions is a little bit shorter, but we've asked again about number of homes that you operate, the total number of beds that your organization operates. This helps us get an idea of scale of your particular operation. We've asked for stipend or payment amounts that are associated with the person who's actually providing the care, and again, transportation costs that you may have that person may incur. And I definitely want to jump over with an eye on the time, but I definitely want to make sure we talk about meals. Um, so first, if you are a meals only provider, you only provide congregate or home delivered meals and you don't provide anything else that is listed in the survey, there is a separate meals survey for you to fill out. Many of the orange tabs that we looked at the beginning are the same tabs, but you don't need to fill out the very large survey. You can fill out just the meal specific survey to make your life a little bit easier. But we've asked a number of questions, including questions about your revenue and your costs on the meal specific tab here. These are specific to meals. So when we ask about your revenue here, we want to get a little bit more detail. Uh, this is extremely relevant for things like Title III revenue, and how Title III is built out when we do meals costs. And then a number of very specific meals questions about the cost to deliver those meals. Um, and we've already seen that the costs in Alaska are quite a bit different than we see in the lower 48 states as we've been looking into other states and their meals programs. And so we want all that information from you as much as possible. Now this tab has a little bit is a little bit different with the way things gray out. This cell in particular, row 34, you'll see this grayed out unless you both deliver home and congregate meals, and then this becomes relevant. Um, so don't be surprised if you deliver one or the other and this stays grayed out. Um, and we ask about your total number of meals and any donated services that you may be getting towards those meals. Again, that's very relevant for how Title III is decided through regulations. And of course, as with many of the other spots, we've added a specify box here. If you have other types of donations, please specify. Let us know what types of donations you're getting, so we can make our best recommendations off of that. And I know I went through that a little bit quickly. Poorna, do you have any additional context you want to add?
Nothing at this point, and I don't see any questions or comments in the chat. Yeah, I'll just broadly add for all these tabs. I think Sean went through a couple of examples, like, your respite is one type of tab. Another one is a residential, service where we ask for some demarcations. Other one's meals, but you'll see there are some patterns in the types of questions we ask across all these tabs. Again, not everyone will have to fill all these tabs, that it depends on the services you provide, which is why the first step is like fill that programs and services tab, and then you'll know which tabs you actually have to respond to so you can ignore the others, right? But when you go through these tabs, you'll see, like, especially with, I think productivity is one big piece, the staffing patterns are another big piece. These are some key areas, especially like here's where we get into things like service delivery outside of just costs, right? Like understanding whether there are different ratios during the day, during the night, right? Do you maybe have lesser staff at night than during the day? How much time may be spent on like transportation, and what's the cost like for flights, right? If say your staff have to like take a flight to, get from place to place. There's a lot of like details that way. Again, no other context to add here except that like you start here and then dive into some of those tabs. I know we have 6 minutes to go, so I think we can take a couple of minutes with benefits. And then we will just wrap up with, Tony from DOH is here, who will provide some more like context on like the broader goals of the study and how this work came about. So I do want to ensure we leave a little bit of time for that.
Yeah, and all of these extra tabs, these blue tabs, that's why we'll often call these cost-informed rates rather than cost-based rates, because if we were just doing cost-based rates, we would just be looking at your cost reports and doing a simple equation. But this is a lot more in depth to try and understand some of those hidden costs too, and understand what you really need to fully provide your services, which you may or may not be receiving right now, which is a part of the, analyzing your rates. Um, And a big portion of this, especially for some of the smaller providers, is understanding what you currently provide for benefits. So we've asked a number of questions about the different benefits you provide. The first section here is on health, vision, and dental insurance. And I guess I should back up for just a moment. These, again, we want to know about direct care and direct supervision staff that are getting these benefits. That's where we want to get answers that are focused towards those particular staff members. But we ask questions about your health, vision, and dental insurance. How much does it cost the employee? How much does it cost the employer? How many people are receiving these types of benefits? We also ask about retirement benefits that you may provide, other benefits that you may provide, whether that be long-term or short-term disability or legal insurance or pet insurance, whatever you might happen to provide for your employees. We want to know about any of those other benefits that are not explicitly called out above. I know we talked about unemployment and workers' compensation in total costs, but we're asking what your actual rates are for the workers' compensation and unemployment. And then also, what type of time off do you offer to your staff currently? And the different types of vacations, sick days, holidays that you're currently offering to your staff, because that's an important part of their total compensation, not just their wage. And go ahead and move on to the additional feedback tab. Our feedback in the before surveys on the additional feedback tab, oftentimes people are like, are you even going to read this? The answer is yes. Yes, yes, yes. We absolutely do read this. If you have additional things that you think we need to know or clarifications from any of the tabs that didn't fit into a specify box or weren't 100%, this is an opportunity for you to tell us all of those things that you think would help improve the program. We do really read them. We do really bring them back to the state, and they are really helpful to us moving forward. And Poorna, because we have 3 minutes, I'll go ahead and toss it back to you.
Yeah, let's move back to the slides quickly, and then I'll leave the last couple of minutes for Tony. So I wanted to quickly go over some of the timelines and what next. So today is essentially our first training session. Next Monday, we'll have another session, which is pretty much identical to this. But again, a lot of these discussions are driven by the questions we may get in the chat, right? So you can feel free to join if you'd like, but the recordings will be made available. And after this, basically, everybody has 2 months up to December 13th to respond to the survey. And in the next 3 weeks, we'll also send a frequently asked questions document that will have questions, responses to some of the questions asked most frequently in the chat here in the trainings, as well as in the mailbox. And then you submitted a Guidehouse. So moving to the next couple of slides, I'm going to skip next one, but we'll share this offline. Just some tips and tricks to keep in mind when the survey. We went over most of these. Let's move to the next one. Again, just re-emphasizing that there are 2 training sessions, identical content. FAQs will be submitted, and you can reach us at this email ID, and we will respond to you within 2 business days. And in some cases, we may need to schedule a meeting too, which we can decide on a case-by-case basis. All right. And that said, the last slide will just wrap up with how do you submit the survey. Again, we've noted here December 13th is the deadline, but we've also included some tips on when you send this back to us, include in a subject line saying it's a survey submission, include your agency name and the name of the workbook. So just some things to keep in mind. Again, not mandatory, but this just makes it, when we get it from you, as soon as we see the workbook, we know, okay, who submitted it to us, right? But this brings us to the end of the conversation. I just want to wrap up by passing the baton to the DOH and the DOH staff are here. I'll pass it to Tony, who will just share some concluding remarks and also provide some background around how this work came about. Tony, if you can hear me, over to you.
Yeah, thank you, Poorna, and thanks everybody for coming today. Good turnout. I just wanted to provide just a little bit of basic background based on the questions I saw in the chat. Kind of where is this work coming from? Why is this work before us? And I just wanted to say it came from the last time we rebased the rates for the long-term services and supports, all the SDS services. The biggest concern that was expressed to us through public comment was that there were flaws, there were shortcomings with the existing state methodology, and that needed to go into a workshop and get a good, thorough look. This is your chance to let us know what you see as those flaws and shortcomings. We're beginning here with this survey to get an understanding of what it costs to operate your agencies. And this is the beginning of a process. I know it's a lot of work, but we are really glad that we could be responsive and find the resources that is enabling Guidehouse to do this work. So I just wanted to kind of set that table. Probably could have done it in the beginning of the teleconference. I saw some concerns expressed. What if these results are going to be used to reduce rates? I want to say you have our word that this is the beginning of a process that is going to involve plenty of review and comment by those of you when the results are final. So please take the time to do the survey. If you need to share it with your administrator, with your others in the staff, because we know that as it was remarked on, that people are not necessarily in harmony, or who are gonna deal with the survey results. Please pass it around your organization if you're worried about that, or be in touch with Guidehouse, as Poorna indicated. So just thanks again. Thanks for being here. And Poorna, I'll turn it back to you.
Thank you, Tony. And again, just echoing what Tony said, appreciate everybody for joining us today, for being on this call, for asking a lot of thoughtful questions. And, if you don't have the survey workbook, write to us, we'll get it over to you. If you have questions when your agency is filling out the survey, they can contact us and we will, write back to you, schedule a call, whatever it takes to help you get across the finish line. And all in all, a reminder again that we have another training next Monday. So if you make any progress this week, or you want to attend another training session, you're welcome to join us next week again. But again, content is identical. So we will keep an eye out for your surveys. And again, I appreciate everybody for joining in and taking the time to ask the questions on behalf of a lot of the providers as well. So thank you all and have a good day.